Did you know that nearly half of all adults over 50 have high blood pressure, and many don't even know it? High blood pressure is called the silent killer because it often has no symptoms until it's too late. But there are 6 warning signs that should never be ignored. If you experience any of these, it could be a sign that your blood pressure is dangerously high. Let's dive into the 6 warning signs of high blood pressure after 50. High blood pressure, or hypertension, affects nearly 120 million Americans, and the risk increases dramatically after age 50. When your blood pressure stays elevated, it puts extra strain on your heart, arteries, kidneys, and brain, increasing your risk of heart attack, stroke, and kidney disease. The challenge is that most people with high blood pressure feel perfectly fine, which is why it's so dangerous. But in some cases, especially when blood pressure spikes suddenly or reaches dangerous levels, your body sends warning signals. Here are the 6 signs you need to watch for. The first warning sign is severe, persistent headaches, especially in the morning. While headaches are common and usually harmless, a specific type of headache can signal dangerously high blood pressure. These hypertensive headaches typically feel like a pounding or throbbing sensation on both sides of your head, and they're often worse when you first wake up. The headache may be accompanied by a feeling of pressure behind your eyes. This happens because extremely high blood pressure can cause your blood vessels to swell and put pressure on your brain. If you're experiencing frequent morning headaches that don't respond to over-the-counter pain relievers, especially if you're over 50, get your blood pressure checked immediately. The second warning sign is frequent dizziness or lightheadedness, particularly when standing up quickly. While occasional dizziness can be caused by many things, persistent or severe dizziness can indicate that your blood pressure is affecting blood flow to your brain. High blood pressure can damage the blood vessels that supply your brain, reducing oxygen delivery and causing that dizzy, off-balance feeling. You might feel like the room is spinning, or you might feel unsteady on your feet. Some people describe it as feeling like they might faint. This is especially concerning if it happens frequently or is accompanied by other symptoms on this list. If you're experiencing regular episodes of dizziness, especially if you're over 50, don't ignore it. The third warning sign is chest pain, tightness, or pressure. This is one of the most serious warning signs because it can indicate that high blood pressure is damaging your heart. When your blood pressure is chronically elevated, your heart has to work much harder to pump blood throughout your body. Over time, this extra workload can cause your heart muscle to thicken and stiffen, reducing its ability to pump efficiently. You might feel a squeezing sensation in your chest, pressure, or discomfort that may spread to your shoulders, arms, neck, or jaw. Some people describe it as feeling like an elephant is sitting on their chest. Chest pain should always be taken seriously. If you experience chest pain or pressure, especially if it's accompanied by shortness of breath or sweating, seek emergency medical attention immediately. The fourth warning sign is shortness of breath, especially during activities that didn't used to cause breathing problems. High blood pressure forces your heart to work harder, and over time, this can lead to heart failure, where your heart can't pump blood effectively. When this happens, fluid can back up into your lungs, making it difficult to breathe. You might notice that you're getting winded climbing stairs, walking short distances, or even lying flat in bed. Some people wake up at night gasping for air. This symptom is particularly concerning because it suggests that high blood pressure has already begun to damage your heart. If you're experiencing unexplained shortness of breath, especially if it's getting progressively worse, see your doctor as soon as possible. The fifth warning sign is vision problems, including blurred vision, seeing spots, or temporary vision loss. High blood pressure can damage the tiny blood vessels in your eyes, a condition called hypertensive retinopathy. When blood pressure spikes, these delicate vessels can leak or burst, causing vision changes. You might notice that your vision becomes blurry or that you see spots or floaters. In severe cases, you might experience temporary vision loss in one or both eyes. These symptoms can come on suddenly and may be accompanied by headaches. Vision problems related to high blood pressure are a medical emergency because they indicate that your blood pressure is high enough to cause damage to your blood vessels. If you experience sudden vision changes, seek medical attention immediately. The sixth warning sign is frequent or severe nosebleeds. While nosebleeds are common and usually harmless, recurrent nosebleeds in adults over 50 can be a sign of high blood pressure. When your blood pressure is elevated, it puts extra pressure on the delicate blood vessels in your nose, making them more likely to rupture and bleed. These nosebleeds may be more difficult to stop than typical nosebleeds and may occur without any obvious trigger like dry air or nose picking. If you're experiencing frequent nosebleeds, especially if they're accompanied by any other symptoms on this list, it's important to have your blood pressure checked. While nosebleeds alone aren't usually an emergency, they can be a warning sign that your blood pressure needs attention. Now here's the most important thing you need to know. Most people with high blood pressure have no symptoms at all. That's why it's called the silent killer. You can have dangerously high blood pressure and feel perfectly fine. The warning signs we just discussed typically only appear when blood pressure reaches extremely high levels or has been elevated for a long time and has already caused damage. This is why regular blood pressure monitoring is so critical, especially after age 50. The American Heart Association recommends that all adults have their blood pressure checked at least once every 2 years, and more frequently if you have risk factors or a history of high blood pressure. So what should you do? First, if you're experiencing any of these warning signs, especially chest pain, severe headaches, or sudden vision changes, seek medical attention immediately. These can be signs of a hypertensive crisis, which is a medical emergency. Second, even if you feel fine, get your blood pressure checked regularly. You can have it checked at your doctor's office, at many pharmacies, or you can monitor it at home with a home blood pressure monitor. Third, if you're diagnosed with high blood pressure, work with your doctor to manage it through lifestyle changes like diet, exercise, stress management, and if necessary, medication. Controlling your blood pressure can dramatically reduce your risk of heart attack, stroke, and other serious complications. If you found this video helpful, please give it a thumbs up and subscribe to Wellness After 50 for more evidence-based health information. And let me know in the comments, have you experienced any of these warning signs? Or do you have questions about managing high blood pressure after 50? Thanks for watching, and I'll see you in the next video.